We have 1.4 million uncovered Pennsylvanians. This is a problem in our state. We've got to address it immediately. So what we have is skyrocketing premiums at the same time that we have reduction in coverage. The real costs have to do with lost productivity. The real costs have to do with lost business to other countries, other Western industrialized countries that have health care and we do not. We pay for health care, our poor health care, and lost lives. And people are literally dying in their homes, their apartments, and hospitals. Those who show up in our emergency rooms who did not have preventive care, did not have basic health care. What we need to figure out is that, and address ourselves to, is the fact that we pay twice as much as the second most expensive healthcare system in the world. Nationally, 46.6 million Americans have no coverage, and tens of millions more have inadequate coverage. Only people who are insulated are the top 2%. Our current system now costs 30 to 35% in overhead, whereas a publicly financed system, as you find throughout the Western industrial world, is a fraction of that cost, roughly 3 to 5% across the board. We pay 10 times as much for privatized administrative bureaucracy. We're talking then about businesses and individuals paying far too much for health care that is diminishing, that is cutting into people's lives, quality of life, opportunity, that is denying our ability to prosper, to grow as a society. Well, fortunately for us, there's already been a movement afoot for the last 2 years to develop the legislation. In the House, it's known as House Bill 2722. It's already been introduced into the state legislature. It has several sponsors, and we're in the process of picking up more sponsors, legislative sponsors, to change minds and to win support for this legislation. So House Bill 2722 and Senate Bill 1085 provide comprehensive, quality health care. We're talking here about publicly funded, privately provided health care. What that means is that your doctor, your current set of doctors, special, as long as they're part of the system, you will have full access to them. So everybody gets to work and continue to be with their doctor. The system, for those who join it, will be free of the burden of malpractice insurance. It will benefit doctors, it will benefit consumers, it will benefit providers, it will benefit the business community, it will benefit everyone. It relieves property tax. This initiative will relieve property tax dramatically. Roughly 25% of property taxes goes to fund our public school system, and when we deliver comprehensive quality health care to schools, that will reduce your property taxes commensurately, 25%. Now, putting all of our cards on the table, there is a buy-in cost into the process, and that'll be roughly 10% of your property tax. But this is the single best answer to the property tax burden that people have to bear. In addition, this will relieve businesses of the single most inflationary cost in their budgets. The single fastest growing cost for businesses is that of providing health care for each of its employees. We're targeting state legislators, those who are willing to listen. The Governor Ed Rendell, has said that if he's presented with single-payer health care legislation, he will sign it. What's going on here in Pennsylvania is something part of a national movement. What we need are citizen volunteers. We need folks to jump in as much as possible, because we're going to be going head-to-head with a force that is willing to spend whatever it takes to protect their fiefdom. And what they do is they rip us off, and each and everyone knows that out there. But we've got to deal with the reality. So that's why it's important that we have a citizen-based movement of volunteers willing and ready to step in this year, the year 2007, to write letters to the editor, to be willing to meet with your state legislators and state senators, to be able to educate yourself, educate your neighbors, educate anyone willing to listen. We need volunteers to win this legislation in the House, House Bill 2722, in the Senate, Senate Bill 1085 to serve as a model for how we can get it right at the national level. There's no reason that universal, comprehensive, quality health care cannot be modeled here in Pennsylvania and carried forth at the national level. So we want you folks to register here at Citizen Solutions PA or go to citizensolutionspa.org and come back and visit the site as frequently as you need to stay active and to know where other Pennsylvanians are going in terms of pushing on this legislation and winning. This is our opportunity. Let's not blow it. Let's take advantage of it. Let's get to work. Thank you.